will be covering in this presentation that what are high alert medicines and why we should be concerned about the errors and harms associated with these drugs. Number two, introduction to National High Alert Medicine Guideline Pakistan. What are the main contents of the guidelines? And a word about master list of high alert medicines for Pakistan. And lastly, how to access full document of guidelines and the master list through DRAP's website. मेरा नाम सलवा एहसन है। मैं चीफ ऑफ फार्मेसी शिफा इंटरनेशनल हॉस्पिटल और सीनियर वाइस प्रेसिडेंट पाकिस्तान सोसाइटी ऑफ हेल्थ सिस्टम फार्मासिस्ट के तौर पे आपसे मुखातिब हूँ और आज आपको ब्रीफ करूँगी पाकिस्तान नेशनल हाई अलर्ट मेडिकेशन गाइडलाइंस के बारे में। 1 in 20 patients attending healthcare facilities is exposed to avoidable medication harm, and 1 in 4 patients face severe or life-threatening harm, as per the WHO Global Patient Safety Challenge. The high alert medications are responsible for serious and life-threatening patient harms across the globe. Hence, understanding the risks and steps for prevention is really important. To address this concern, for the very first time, Pakistan's National High Alert Medication Guidelines have been developed with the Association of Pakistan Society of Health System Pharmacists, and it is duly endorsed by International Pharmaceutical Federation and finally approved and notified at the national level by Drug Regulatory Authority of Pakistan in September 2022. In the letter issued by DRAP on 27th of September 2022, DRAP has directed all the healthcare facilities across Pakistan, both public and private, to ensure that they develop their high alert medication list specific to their own healthcare facility within 6 months, that is by March 2023. Once their list is developed, they need to train their healthcare staff on that particular list, that which drugs they have designated as high alert medication for their hospital, and to display the lists prominently in the pharmacies, doctors' offices, and nursing stations for a constant reminder for the healthcare staff. These guidelines are now available on the DRAP's website and can be easily accessed by all. Let me take you through the content of the guidelines. The initial sections comprise of the purpose, the introduction, why the high alert medications, what are high alert medications, what risks are associated, and how to effectively use these guidelines are included. In the next section, the individual medication management stages are being discussed, that if high alert medications are supposed procured, stored, prescribed, dispensed, prepared, administered, monitoring and patient education related steps, what best practices are to be implemented in order to safeguard the patients from harm from the high alert medications. In the next section, the list of high alert medications, which is designated at the national level, or you can refer to them as master list, is available. This National High Alert Medication List comprises of all the high alert medications that are available in Pakistan. This list may be revised from time to time as the drugs may be available in future. So always refer to the most updated master list whenever you are referring in order to make your own high alert medication guidelines for your hospitals. So let me take you to the next section. After the list, there are individual high alert medication monographs. In the monographs, the details about each medication which is high alert has been provided. Let's take an example of section 10.5, which is related to the class of anticoagulants, antithrombotics, and thrombolytics. If you go to this section or any particular drug, you will find out that why this particular medication or medication class is high alert, what are the risks associated with this class of drug, what are the main issues, errors, and incidents that are reported internationally or globally, so that you can identify the risk similar to that occurring in your institution, and you can further develop policies and SOPs to mitigate the risk. This is followed by the individual section related to that class. For example, how you're going to store the anticoagulants within pharmacies or outside pharmacies when they are stored in nursing floors, clinics, emergency rooms, or operating rooms, for example. How these medications are prescribed, how the bleeding risk assessment should take place, what laboratory values must be checked before ordering, how the prescription should be written, and things like that. In the dispensing section, you will find out that while reviewing the prescription, what pharmacist needs to know and check while medication order is being reviewed, and in what method and formulation the medications must be dispensed so that at the administration side, no error could occur. The administration and monitoring part will tell you that how to safely administer anticoagulants or antithrombotics, how the rate should be controlled, what parameters should be monitored, and if any kind of overdose or toxicity occurs, what emergency measures must be taken. This is followed by the last section, which is patient education, that for the antithrombotics or anticoagulants, what specific information you need to provide to the patient so that when they are administering the medications at their homes, they also know the best practices and they can prevent the errors. So in summary, high alert medication guidelines are notified by DRAP at the national level in Pakistan. Due to extreme risk of patient harm, it is important that all healthcare professionals gain knowledge about these medications, their associated risks, and the best practices to avoid patient harm. So, in order to know all these 3 points, please refer to High Alert Medication Guidelines. Thank you. To access the guidelines, please visit DRAFT's website or follow Pakistan Society of Health System Pharmacists website or their official pages on Facebook and LinkedIn. Know your role, play your part.